Hello and welcome to our webinar, Using NextGen to Navigate Minors' Medical Records. My name is Chelsea Grober and I'm the Marketing Communications Manager for DAS Health. Before we get started on today's webinar, I want to take a moment to explain the process for the presentation. First, I'd like to mention this webinar will be recorded and that we'll send out a copy of the slides along with the recording within the next week. I also want to mention this webinar does cover some state laws, federal laws, local laws. Please use these as guidance and know that they should not be used as legal advice. Okay, so I have some super exciting news to share with you all. As I'm sure you know by now, DAS or ITENIV is now part of DAS Health. DAS Health is a leading provider of health IT and management solutions, a trusted consultant to many physicians groups, hospitals, and healthcare systems across North America. By combining our skills and expertise, we'll be able to provide even more support, value, and solutions to your practice. And we're looking forward to continuing to serve you. Again, I want to reassure you all that we are still here for you. We're still here specializing in NextGen and keeping our focus on you. As you know, we specialize in NextGen healthcare, and we're passionate about providing solutions for healthcare provider partners, which in turn help them to improve patient care, enhance the patient experience, and maintain a financially healthy practice. To sum it up, we do everything NextGen. We also have add-on productivities for NextGen, including ChartGuard, Refund Manager, Unapplied and Deposit Manager, and Multiple Encounter Billing Manager. Next, I want to mention an upcoming webinar that we're going to be presenting in March that we're going to be covering a deep dive into the cost estimation in NextGen. So keep your eyes out on LinkedIn, social media, your emails. We'll be sending an invite out for that about a week before the webinar, and we hope to see you there. Okay, so back to today's webinar on using NextGen to navigate minors' medical records. At the end of the presentation, we'll open the floor up to questions from you. We'll answer all the questions at the end, but you can type them in the questions area of the webinar control panel whenever they occur to you. And finally, for audio clarity purposes, everyone's phone will remain muted throughout the entire webinar. If you experience audio issues, please use the chat box to let us know so we can resolve them. And again, questions may be entered in the questions box. So without further delay, I'd like to introduce our presenters for today. Lexi DeMarsh is Manager of Consultant Development, and Holland Lively is a Client Solutions Analyst at at DAS Health. See, I'm still getting used to the new name too. Anyways, they're both subject matter experts in the topic, and they are excited to be here and presenting for you today. So without any more delay, I'm going to go ahead and hand it off.
Great, thank you, Chelsea. Hi, everyone. Thank you for joining us for our webinar on minor medical records and using NextGen to navigate those. Establishing general guidelines for your practice when dealing with minors and their rights can be complicated, particularly in today's heavily regulated environment. So today in this presentation, we will analyze these regulations and the challenges they present. We also will review tools and functionalities available in both the new NextGen PxP portal, as well as protecting team confidentiality within NextGen Enterprise itself. In addition, due to COVID-19, we have added a brief section on telehealth and minors with emphasis on the TIKES Act legislation and its impact as well. We picked this topic because we understand that finding harmony is difficult when balancing parental rights and those of your minor patients. We want to make sure you are aware of the regulation and the tools already available to you to ensure compliance. So we wanted to begin by reviewing the HIPAA laws that apply to minor confidentiality. Let's start with the basics and work our way through it because we all know HIPAA is the cornerstone regulation for this topic. The HIPAA privacy rule is the federal standard that generally allows a parent to have access to the medical records about his or her child when such access is not inconsistent with state or other laws. HIPAA really, again, is the foundation and sets that bare minimum. So the parent of a minor is typically considered the minor's personal representative or the person with legal authority to make healthcare decisions on behalf of the individual. As we mentioned, the HIPAA privacy rule is the federal standard, but HIPAA does defer to state or other applicable laws if those laws are more stringent than HIPAA. So medical record access for minors is more typically defined at the state level. So for minors under the age of 12, most states will allow full parental access to medical records, and for minors between the ages of 12 and 17, the parental right to access medical records depends on the type of treatment the patient is receiving. So under HIPAA, there are 3 situations when the parents would not be the minor's personal representative and would be unable to access their records. They are when the minor is the one who consents to care and the consent of the parent is not required by law, for example, testing for an STD. Or when the minor obtains care at the direction of a court or a person appointed by the court, such as court approval to obtain an abortion without the parent's knowledge. And lastly, when the parent agrees that the minor and the healthcare provider may have a confidential relationship, which occurs most often when an adolescent is seen by a physician who knows the family. However, even in these situations, the parents may have access to the medical records of the minor related to this treatment when state or other applicable law permits such parental access. Now, if the state law is silent on a parent's right of access in these cases, the licensed healthcare provider may exercise his or her professional judgment to the extent allowed by law to grant or deny parental access to the minor's medical information, which leads us to the parent's access to information. In those situations that we just discussed, when a minor's parent would not have the access to the minor's records, the minor is considered the individual. When this is the case, the minor may exercise most of the same rights as an adult under the HIPAA privacy rule, except where state or other applicable law says otherwise. I feel like that is really just, the money phrase for this webinar. I'm probably going to say it a dozen more times today. But those state or other applicable laws can require information to be disclosed to the parent, which I will say is mandated in, few states. They may permit information to be disclosed to the parent, which would be at the provider's discretion. They may prohibit information from being disclosed to the parent, or even the state law may be silent on the matter, which would leave the choice of record access up to the provider. So the key words here really for each scenario are require, permit, prohibit, and silent. Those are your options. So there's also crucial special privacy protection where under the HIPAA privacy rule, a provider may choose not to treat a parent as a personal representative when the provider reasonably believes in his or her professional judgment that the child has been or may be subjected to domestic violence, abuse, or neglect, or that treating the parent as the child's personal representative could endanger the child. Now, from what we've discussed so far, I think it is clear that HIPAA and state laws are trying to put the well-being of the minor at the forefront of the purpose of their laws. But sadly, there is no one simple law for all states, and we, of course, don't want to spend your time discussing 50 different state laws. But in general, every state has laws that allow minors to give their own consent for some kind of health care, including emergency, general health, contraceptive health, pregnancy-related, HIV, other STDs, substance abuse, and mental health care as well. Every state also has some laws that allow minors to consent for care if they are emancipated, mature, living apart from their parents, pregnant, parents, high school graduates, or older than a certain age. The HIPAA privacy rule defers to these laws. Basically, adolescents and their healthcare providers expect that when an adolescent can consent to their own healthcare, such as in these situations I just suggested, that information pertaining to it will usually be considered confidential. Kind of just a rule of thumb and explaining this as simply as possible. Now, as much as we wish we could give you a blanket recommendation for how to approach minor confidentiality, laws truly vary by state. We aren't just saying that, and to prove it to you, we did want to include this slide so you can see some examples of how much states can vary for allowing minors to consent to different types of treatment. You can see that in New York and Ohio, it's a common requirement for a minor to be deemed mature by a physician in order to accept treatment. While there is a specific definition of a mature minor in each state, generally it means that the physician considers the minor to be emotionally and intellectually mature enough to give informed consent for a certain treatment without parental consent. You can see the differences in age ranges for different treatment across the 4 states. I see, 12, 14, 16, even any age, it all really depends. So the moral of the story is if you're currently working on or implementing or reviewing your own practice policies around minor confidentiality, make sure you are thoroughly researching your individual state laws. And of course, the obligatory COVID-19. The CDC has now recommended the COVID-19 vaccine for everyone ages 5 and older. So what does this mean for patients between the ages of 12 and 17 that want to receive the COVID vaccine, but are maybe in a situation where they disagree with their parents regarding vaccination status? Depending on the state, minors can individually consent to COVID vaccinations, meaning their decision to get vaccinated may be kept confidential from their parent or personal representative. These states include Alabama at the age of 14, Oregon at the age of 15, Rhode Island at the age of 16, South Carolina at the age of 16, and the District of Columbia at the age of 11. So before we get away from HIPAA completely, we do want to discuss a relatively newer buzz term, maybe a few years at this point, that you may have been hearing a lot, and that is the HIPAA Right of Access Initiative. So when you hear the term HIPAA privacy rule, the first thing you could think of is the obligation to keep PHI secure and to not disclose it inappropriately. But there is a lesser known part of the privacy rule called the right of access that seemed to fly somewhat under the radar for many years because it was rarely enforced or audited. So in 2019, OCR commenced its right of access initiative to make it a priority to support individuals' rights to a timely, within 30 days, access to their health records at a reasonable cost. In 2020, the OCR aggressively began to enforce the right of access initiative with many of these instances involving minor records. It's important to note that while OCR has relaxed some portions of HIPAA during the public health emergency, this has not extended to the right of access requirement. And I keep dramatically emphasizing those bullets because I can't, it seems like it's everywhere on a weekly basis where right of access violations or settlement articles are coming through. They've really cracked down on this. It's kind of feeling like there's some tunnel vision on, that right of access. So while the right of access initiative does not explicitly involve minors, I do want to bring to attention to it today because the enforcement, again, is a few years old and several of those settlements that have been reached have actually involved minors' records. So one of the first highly publicized examples of the right of access initiative involved a mother who complained to OCR of a health system that failed to provide her with timely access of her newborn's records. So in October of 2017, a mother submitted a written request to a health center requesting the fetal heart rate monitor records from her delivery. Initially, that health system stated that the records were not found before later producing the records in August of 2018 in response to the mother's attorney. So the mother then submitted a complaint to OCR since the health system did not provide the records for her child within 30 days. OCR reached an $85,000 settlement with the health system in 2019, making it that first case settled in the HIPAA Right of Access Initiative. And as I said earlier, note, these are coming through, it seems like, even more frequently. So how can you ensure that you're complying and providing your patients with timely access? So let's start, with the general requirements of the right of access portion of the rule. So that general requirement is for covered entities to provide individuals upon request with access to PHI about them or a minor for which they are the personal representative in a timely manner. Timely is generally considered within 30 days of the receipt of the request. Psychotherapy notes should not be included in these requests, and there are specific rules regarding the maximum fees that can be charged when providing records to those patients. Like all aspects of HIPAA, you need to have policies and procedures in place that help to ensure your practice is responding to patient record requests in a timely manner. Ensuring that you train all staff on HIPAA laws, particularly when it comes to responding to record requests. Unlike HIPAA data breach settlements, which tend to involve, breach of hundreds, thousands, or even millions of patient records, right of access settlements have stemmed from complaints filed by just one singular person. And going along with the main theme of our webinar is you need to reference state laws. So as a rule of thumb, if the state law is more strict or more stringent than HIPAA, it will take precedence. For example, If your state happens to consider timely return on records to be 15 days, then you need to get your records to your patients within 15 days, not that 30-day frame that is set by HIPAA. There are certainly a lot of aspects of confidentiality to keep track of when it comes to HIPAA and state laws. I'm sure you may be wondering, what is the best way to ensure I'm following all of these laws, and how can I utilize NextGen to help me with this? Well, we do have some ideas on how NextGen can help, and I'm going to pass it over to Lexi so she can dive further into this.
All right, thanks so much, Holland. So as I'm sure you are kind of coming to understand, from everything Holland has discussed so far, there really are so many nuances, to these medical record laws for minors, and when parents and guardians can have access. So it can kind of make it hard, to get a clear-cut protocol for handling these instances. So I did just want to point out before we jump into some solutions that at this time, NextGen doesn't really have any processes set up to necessarily automate restrictions for access, specifically, looking at minor records. But that we will be discussing, some best practices, some solutions that you can implement in your practice to ensure that you are following all those confidentiality laws for your minor patients. So first off, it is important that you track any occasion when those records for minors are disclosed. So really this, as I'm sure you're aware, this isn't limited just to minors. It's any time that information is disclosed out of your system, but it becomes even a little more important, when we are talking about minors. So what should you consider when you're creating these processes for your practice for appropriate record disclosure? So while we're starting to kind of sound like a broken record, as said many times before, really thoroughly understanding those federal and state laws that apply to your practice. Sounds kind of intuitive, but just really making sure that you know what exactly you need to make sure that you are being compliant. Next, you need to make sure that you obtain all the proper consents. So again, a lot of this applies to any patient, but especially when it comes to minors. Just make sure that you are getting those proper consents that are required, both from the patient and then also from the parent or guardian when it applies. Next, you need to make sure that your entire team is really well educated on your processes. The best laid plans, if they're not made clear to the staff and they're not actually executed on a day-to-day basis, they won't really do you any good. So making sure that there's no ambiguity, everyone's clear, on what they need to do will just kind of help, eliminate any problems that might arise. And then finally, making sure you're documenting any of those disclosures in the appropriate area in the EHR. So we'll dive into that in a little bit. So in order to document those disclosures, kind of the best place to do that in NextGen is the PHI Log. So if you aren't familiar with this, or it's not something that your practice is currently using, there is a feature within NextGen, the PHI Log, that allows you to track a few things. So first, how that record request was made. So whether the patient called in, whether they're in the office, if the request comes from a different provider, hospital, things like that. What format those records were requested in. So as you're probably aware, those requests could come, to have the paper records given to them if they want them electronically. So you can specify that in the PHI log. And then finally, as you can imagine, it's important to document when those records then were actually provided. So again, that kind of goes back to some of the stuff that Holland was talking about timeliness. So it's just important to make sure that that is included in one place you can easily reference if an issue ever arose. So this PHI log can be accessed in several places within NextGen. The simplest and what I usually recommend is a good policy for practices is to use the PHI log link that is in your patient information bar. It's kind of simple, you just don't have to search for it. They can just click on that, complete this log when needed. So when those record requests are received, both the clinical and your front office staff, or whoever, if you have a medical records department, they will use the EHR in addition to documenting that disclosure of PHI, but also to view any HIPAA documentation as needed. So those PHI disclosures, they can also be added automatically. So we're just discussing how you can manually add those, but they can also be added automatically by the system. For example, like if your practice uses NextGen Share. So when that information is shared, that disclosure would automatically be added to the PHI log. So if you are not using Share or some other kind of system to automatically export information, then you would go in and we can show you an example of how to manually add that PHI log disclosure to the patient's record. So once you have opened that PHI log link, you will see, for example, like this screen, and you can select that Add button. This is going to open up a pop-up window, and this is going to allow you to document that disclosure of PHI. So I know it's kind of small on your screen, but we kind of filled out an example here. So here we have a physician that requested a patient's record, so an outside physician. And then you can see the options to fill in, again, some of the stuff we talked about, like who requested the record, how it was ultimately provided, the purpose of the disclosure, which is, again, also important, to basically justify why this information is being given out. And then if you also see there's a processed by box, and that's where the NextGen admin is currently filled in, but this would, just the way this was created, but normally it would fill in with the name of the user that's logged into system. So what's nice is it automatically adds the name of that user, and then you can see who actually completed that release of the PHI. So once all of that information has been added and saved, that disclosure would then be added to that grid that we see on the right. Basically just shows you all of the PHI disclosures for that patient in one place. So again, just makes it easy for your staff to have that record, go back and reference it as needed. So you can make sure it's in one place. If you select the PHI log history, it also is going to allow you to produce a document with all of those PHI disclosure details. So then you can give out that document as needed, print it. So again, that can help your practice if you do ever have a situation where you need to prove what was given and when. And then, as I mentioned, in addition to that PHI disclosures log, we also have another really important pop-up window for tracking disclosures of records, especially with minors, and that is our HIPAA disclosure window. So this is a pop-up that you can also access from a link from the patient information bar, so it's just usually that HIPAA link. And as you can see here, this really allows you to kind of make any notes specifically for this patient and what their HIPAA information, what disclosures they allow. So you can really add any kind of notes. Typically a lot of times practices will save, a copy of the exact form that was filled out by the patient, so we could still be able to see that under categories. But this just gives you a place to kind of cut and dry, say, who they can disclose to, can you leave a voicemail, are there any exceptions? So it obviously can be really important when it comes to minor records. I did want to point out that this pop-up window is something that would have to be checked by staff members, so they have to know to go in and look at it, as well as they have to know to go in and update it. So, whatever your practice's policy for that HIPAA information, as it's updated, maybe things have changed, especially, we're talking minors here, so as they, reach the age of majority, it is important that it's part of your practice's policies to have them review this, as well as to update it when necessary. One of our kind of recommendations, especially if there is something really specific with this HIPAA disclosure, potentially it's a minor and, one parent is able to see records, but the other is not, something along those lines. You can always create an alert in the EHR, and, that can be selected to pop up whenever the chart's open. And you can say something along the lines of, check HIPAA disclosures before releasing records. So it's just kind of a tip to help manage this and make sure it's not getting overlooked by your staff. Okay, so now we've kind of discussed some options for how to, see what can be disclosed and how to track when that disclosure actually happens. But another kind of big piece of this puzzle of working with minor records is how do you know when a patient isn't a minor anymore? So obviously, short of going in each chart and verifying their age and seeing if there's any exclusions, things like that, it can be kind of difficult for practices to track that. So one of the recommendations that we kind of give to practices is to create a patient demographics report. So you can set up the criteria here to basically show me any patients over, in our example, we have over 18 years old. Obviously, depending on your state laws, you might, need to kind of modify this. And then basically, you can include a column in this patient chart demographics report for the guarantor. So it will either tell you, is the guarantor self or is it someone else? So this is a way to kind of be able to go in and update this as needed. So we would go and set up this report, and then some, kind of typical columns we recommend to include, obviously things like the patient's name, the patient's age and years can be set up, as well as, like I mentioned, that guarantor, so you can see, and you can filter it to see, patients under a certain age, like in this example, for any patients that are greater than 17 for years and they are not their own guarantor. So on this slide, you can see some examples of the different columns that, again, we would just recommend and how we filtered it. Again, we're looking at, any patients over the age of 18, but obviously you can modify this as needed or even create multiple versions of this report, depending on, if you're an organization with practices in many states, things like that. So obviously you can imagine this, report is very beneficial to your practice to be able to track it. But, obviously it does need to be tracked consistently. Obviously you have to track it and, hopefully catch those as the patients are aging out. So kind of a recommendation that I usually give to practices, kind of take the burden off your staff to have to remember to run this report. One more thing is that you can configure a BBP job to run this report for you. So you can set this up really to do it on any kind of regular basis. You want this to be weekly or even daily, monthly, however your practice sees fit. You can have this report generate and then be sent to staff that would be responsible for reviewing the report. And then updating that guarantor and, any of the HIPAA, disclosures, things like that, kind of as needed based on your policies or your practices policies. So now that we've covered kind of some of those best practices for, the disclosing of records and updating those patients who've reached the age of majority, we also have another option in NextGen called sensitive encounters. So we've kind of already mentioned that, that HIPAA disclosure pop-up, that guarantor report, they are not automatic. There's something that your staff does have to know to go in, check consistently before they go ahead and make those disclosures. So, really, if the patient or if the staff member, forgets to look at that HIPAA disclosure, potentially could lead to an issue. So one solution to this problem would be to use the sensitive encounter feature in NextGen. So I do want to point out that this was first introduced in 591.841, so it would be available in that version or any higher versions. So the process would basically be to mark an encounter for that patient as sensitive. That happens in our patient history toolbar of the patient's chart. So basically what that does is if a user in your staff attempts to share that information from that encounter, they will be alerted that the encounter contains sensitive information, and it will prompt them to review your practice's policies before continuing. So this applies, whether the information is, being printed, being exported out of your system. We'll just kind of give that warning to hopefully have the staff kind of stop and evaluate what they're doing. Currently, we're seeing that this feature is available for things like statements, the patient portal. I do want to point out that this is referencing both the NextMD portal, so that legacy portal, as well as this feature is still available for the new PxP portal. So if any you have started making that switch, we can also see the sensitive encounters available for referrals that are being sent out, any care outreach campaigns, and then finally that clinical message manager. So for any things like if information is being included, like for example in a CCDA that's being sent out. So the process to mark encounters as sensitive is pretty simple. You would just find that encounter in the patient history toolbar. You'd right-click on that unlocked encounter and select sensitivity settings. There are a few options for how you want to set this up. So the first is to check off that box up at the top for a sensitive encounter. And then additionally, if you want to add additional options, you can do things like suppress auto send to patient portal, which again, that is referencing both the legacy NextMD portal and the PxP portal. So that would basically stop the information that's including on this counter from automatically going out to the portal, as well as an additional checkbox for suppress outreach actions. So again, if you have any outreach campaigns like with NextGen Care, things like that, you can stop this particular encounter from being included. So then, typically once that encounter is locked for that patient, is enrolled in that patient portal, if they are enrolled in the portal, that CCDA is going to automatically generate. So as I just mentioned, choosing that suppress auto send to patient portal is not going to include this information on that CCDA. So it won't be automatically sent to the portal. So again, another option if there's a certain procedure or something that shouldn't be disclosed to a portal, or maybe a patient parent has access, you can suppress sending that. And then again, like that suppress outreach actions is just going to stop that particular encounter and its information from being included on any outreach campaigns that you might have set up. So once you've selected all those appropriate options for the encounter, you will see a red exclamation point next to that encounter. So we'll see that both in the EHR and the PM applications. And basically that just kind of gives the user a quick visual that this is marked as a sensitive encounter. And then anytime a user tries to disclose this information anyway, so things like printing information from the encounter, again, sending it to the portal, including it in a CCDA, things like that, they are going to see that warning message that you see on the right-hand side of your screen, basically just letting them know that there's sensitive information in this encounter. Check practice policies, just be sure you want to send this. You do see that there are two options, so either they can click proceed and it will still let them continue on, so if it is within the practice policies to send it, or they can select cancel sending to not include that information. So as you can see, sensitive encounters might be a great option for your group, to kind of take it one step further. Instead of just having to look at HIPAA disclosures, they would actually get that pop-up anytime they try to send the information out. But as you can kind of imagine, it is just an alert. It's just telling them, hey, double check this. But the user would still be able to click proceed if they wanted to. There aren't currently any rights that would stop the user from continuing on. So the ability to bypass that might be problematic for what your practice is looking for. So if that's the case, some of you might be looking for a way, absolutely prohibit certain encounters from being accessed, from a minor's parent or guardian, or even a staff member. So in that case, there is an option that can be configured to do just that, and that's the case management feature in NextGen. So if your practice offers any behavioral health services, you may already be familiar with this feature. So that's kind of more traditionally where we see it being used. But it's not just exclusive to that specialty. And we have seen scenarios where it works for restricting record access, like we've been talking about today for minor records. So basically, if you aren't familiar, case management is used to group like encounters into a single case, for a variety of purposes. So like I said, more typically behavioral health, but also it could be for any care offered to a minor, especially if it's something more sensitive. So case management could be used to group together, maybe if there was a certain procedure done on a minor patient that shouldn't be disclosed, any encounters related to that could be attached to one case. So the purpose of putting them all in a case is that that case can then be marked private. And basically, if users aren't given access specifically to that case, they would still see the encounter, as we can see in this screenshot, but instead of being able to see that plus sign and see all the information, documents, templates that were generated under that encounter, they would just see a little briefcase. So basically, without the appropriate rights, if it's not within the rights that they need for their job, they wouldn't be able to see any of that sensitive clinical data. And then in addition to preventing, the staff from not being able to see that minor information when not appropriate, it would also prevent that staff member from actually sending out that information in any way. So again, kind of similar to our sensitive encounters, the ability to print the information, exporting it, for example, like in a CCDA, and would also exclude that from being sent to the portal automatically. So it does require the configuration of the case for each patient, and then you would have to add the encounters to the case. But the benefit to this is it really is a surefire way to stop that minor's confidential encounter from being disclosed if it's not appropriate. There's really no way around it for a staff member that doesn't have the rights. Okay, so now that we've talked about a few ways to kind of protect that minor confidentiality within NextGen itself, so within our applications, I did also want to discuss a few options within the new PxP portal in the platform, for things like the portal itself, virtual visits, and kind of how we can navigate that minor confidentiality. So a really beneficial feature of the PxP portal, especially when it comes to managing those minor records, is the ability for parents or guardians to be able to connect their own portal accounts to their child's account using a feature called linked account. So basically to use this, if a practice does want to enable this feature, they would have to allow linked accounts in their site generator account. Once that has been configured, the practice would then send an invitation to that minor's parent or guardian, and then they would be able to view and manage that minor's account. So there's a few things to note with this feature. More than one parent can have access to their child's information. For example, if we have, if the parents are divorced or separated or whatever the case may be, maybe it's a parent and then a grandparent, they can all have their own access, their own login to view that child's portal account. If a parent is also a patient of your practice, they would have two separate accounts, so one for their own portal and then one for the child or dependent. And they would have just one login, though. They would be able to toggle in between their own account and then any other accounts that they are linked to, especially if it's a parent and they have multiple children, they would be able to switch back and forth as needed. So if your practice is utilizing this linked account feature, you do also have the ability to manage the access that is given to that parent or guardian from the practice side. So as you're probably, the gears already turning, it's great to be able to give this access, but it's really important that they only have access to exactly what they need to and what they're allowed to see. So within what's called the practice portal for PxP, the practice can actually access the patient's PxP account via the patient search feature. And then there's a section called family management. Under this family management section, the practice really has the ability to do a few things. They can invite new parents or guardians as needed, send a password reset to the email account on file, which can typically be that parent or guardian's email address, as well as edit that access. So when you click on, there's a link called Edit Access. It's really going to give you the option to really drill down and see everything that the parent or guardian is allowed to view. So as viewing the data, but as well as what actions they can perform. So you can get as specific to say, are they allowed to send messages on behalf of the minor? Can they only view messages? Can they complete forms, request appointments, things like that. So really dependent on the scenario, the access is going to be set up different, for each patient. I do recommend setting up just kind of standard policies for, parents or guardians for what's typically allowed. Whether you leave everything view only or kind of give them full access, just kind of setting that standard. Then obviously you can take it as a case-by-case basis of what's appropriate for that relationship. In addition to those linked accounts, the PxP portal also provides functionality for patients to invite trusted representatives. So this can be, a partner, a caretaker, another adult. So as in, a minor patient could invite a parent or guardian as a trusted representative. So the patient would actually do this on their end. So as opposed to, a linked account, which is set up on the practice's end, they would log into their portal account and go into the account menu, and then they would be prompted to enter the information of that trusted representative. So some things like the first name, last name, relationship to the parent, the email address, or to the patient, excuse me, the email address, things like that. And then the trusted representative will receive an email invite. They will basically be requested to enter some information to identify the patient, just so that way we can identify that it went to the right person and they actually know this person they're being added to. And then they would have access basically to see things on behalf of the patient. They don't need to be a current patient of your practice, just as a note, so it's just can be someone external. And then with the trusted representatives, unlike kind of with our linked accounts, the user would have no restrictions in the portal. So this is just basically them acting kind of as a proxy for the patient. So they would have the ability to do everything, view everything, and perform all actions on the portal like the patient would. Okay, so all these options are great. Linked accounts, trusted representatives, but obviously a hurdle that can come across when working with minor records is when a patient does age out or reaches the age of majority. So as we kind of already discussed, there's not really automatic ways in the EHR or PM application to automatically age out patients. There is, however, functionality available in the PxP portal. So basically, you have the option to automatically age out patients. You can define, when that patient should be aged out. So we'll go over that in a couple slides here. But basically, what that's going to allow you to do is automatically disconnect that child account from the parent account when it's appropriate. You don't have to automatically set them to age out. So if you'd prefer to do it manually, we'll also review how that's possible. So you can go through and basically decide, on a case-by-case basis, or if it's you need to, unlink those accounts for other reasons besides aging out, like if there's other circumstances like the patient ends up being emancipated. So there's a couple of options with how you can handle the age out functionality in the portal. So as I mentioned, that automatic ability to age out, there are a few settings that you can set up in your site generator for the patient portal. And so this will allow you to do a few things. So the first is you can set a practice-wide age out age. So basically that can be kind of across the board, whatever age applies for your organization. So, again, just taking into account those federal and state laws, whatever that age should be. Like in this example here, we have 15 being, across the board, the age out age. So basically based on that, then any patient, if we have this age out set up to automatically turn on, then when the patient reaches the age of 15, it's automatically going to unlink those accounts. But as we've talked about many times already so far, there's a lot of varying state laws. So potentially, if you have an organization, with locations maybe across multiple states, it might not be as cut and dry as to just say one practice-wide age. So in that case, there is also a separate setting for the state age out age. So this allows you to kind of set as many options as required for your organization. You can choose, individual states and then select what that age should be. So, just like most things in NextGen, if a patient is set up to automatically age out, it is going to look for the more specific setting first. So it'll look at those state settings, see if there is a state setting that's applicable there. If not, then it will look directly at that practice age out age then to determine whether or not to unlink those accounts. So it just kind of gives your practice a little more control when you're determining when to unlink that minor from the parent or guardian. So as I mentioned though, if having them automatically age out and unlink doesn't seem like something your practice would want to do, if you prefer to kind of manage that, more on a case-by-case basis, there is another option, and that is our age out report. So that practice portal age out report is available on the Family Management tab. You'd be able to generate this report with some of those parameters we have listed. So things like the status, or are they still considered dependents? Have they aged out? You can filter by decision-making capacity, so either to include all patients, if you've specified when you set up these patients, if they have decision-making capability, if they lack decision-making capability. So things like that that kind of allow you to narrow down, your search a little more, as well as obviously the important factor of the patient's date of birth. So you can go through and really kind of customize this report, and then it would give you the ability to go in and manually age out any patients as needed. So it gives you just like a little bit more control than the automatic option. So when you are using this option to unlink accounts, so age out patients, a placeholder email is added in the practice portal. So that is just to have something in that field. But then in order to go ahead and send that post age out invitation to the patient, so now they're continuing to be a patient at your practice and they need to have their own account, then you would need to go ahead in Practice Portal and actually update that email address. Then that will go ahead, send them the invitation. It removes the parent or guardian, from that account, removes that email, and then it would prompt the patient to create their own credentials. So now they would have access to their own portal. These are a couple of options that we have when it comes to aging out in the portal. Another platform that has some options for minors is our virtual visit platforms. This is part of the PxP. This platform basically allows minors to participate in telehealth visits with their provider. Obviously, also following any federal or state laws when it comes to the ability to do that. So basically, the workflow for a minor to go ahead and join a visit by themselves would be to select that legal representative bubble, as you can see here in this example, when they're going to join the visit. And then they would enter their own name into that box. So instead of it showing as their parent or guardian, and then that would allow them to conduct that visit without the adult present, which again, just as a reminder, keeping in mind your own state laws and things like that. So you can make sure that you're following all of those. So that is an option with the virtual visit platform as far as minors being able to participate. Okay, so as you can see, there are a lot of options within both the enterprise applications as well as the PxP platform that can really help your practice with that sometimes daunting task of handling those minor records. So to wrap up today's webinar, I'm going to turn it back over to Holland, and she's going to discuss a piece of legislation that was introduced in 2019 that's kind of important just to make sure that you're aware of, specifically talking about virtual visits and minors.
Great, thank you, Lexi. So in October of 2020, the Telehealth Improvement for Kids Essential Services, or TIKES Act of 2020 was introduced. The Tykes Act requires the Secretary of HHS to issue guidance to states about how to increase access to telehealth under Medicaid and CHIP. In its early stages, multiple pediatric health systems issued statements in support of this piece of legislation, saying that it creates an opportunity for the federal government to provide more clarity to states regarding telehealth expansion for children. So with this new legislation and many states expanding access to telehealth for both adults and minors, especially in today's day and age, it is important for your practice to consider how you plan to provide those services in a confidential way. We keep saying this, but you really need to go back and understand exactly the case with telehealth moving forward and those state laws that are going to kind of align with that. There's no way that we're going to go back to how it was before this year, with COVID and telehealth taking such a predominant place in our healthcare system. So we absolutely advise how you are going to sit down and decide how you will handle these minors and their telehealth visits sooner rather than later. So in all seriousness, this was a lot of information. And I just want to summarize. So first, understand the laws of your state, and if they're not clear, follow federal guidelines. Also, develop a clear internal policy for how your practice will handle minor confidentiality regarding your EHR. Develop a clear internal policy for how your practice will handle minor confidentiality regarding your patient portal and telehealth as well. And lastly, make sure your entire team understands how your practice will uphold minor confidentiality. So as you can see, this is a highly regulated portion of the industry, and it can be overwhelming. If you're looking for next steps, let DAS Health help, especially if you're uncertain with where your practice stands. We can be visited at itentive.com or dashealth.com. We have these informative webinars and our blog postings and our LinkedIn tech tips. We also offer 3-day fixed price on-site consultations for workflow analysis, revenue cycle and front office, technology and performance workflow reviews. We also offer healthcare industry advisories, and you can even test drive our products. So we've now finally made it to the questions. Thank you for everyone for joining today. I'm going to go ahead and turn it over to Chelsea for any questions that have been submitted during the call. And I do want to preface this by saying if there are any very specific questions regarding certain state requirements, we may not know the answer, but please ask and we will try our best.
Okay, perfect. Thank you, Holland. And again, thank you everybody for joining us today. I hope that you found useful things and useful information and takeaways from this webinar. We're going to go ahead and go through the questions in the order that we've received them. Feel free to keep asking them. We're going to stay on as long as it takes, and we understand if you have to drop off before your question gets answered. We don't have too many though, so don't hesitate to ask if you have them right now. So first question. Do you recommend entering PHI requests even when they are missing components, and what components are missing?
So I'll jump in. I just want to say, we always recommend keeping as much documentation as possible, just, for documentation purposes when maintaining that health record. Lexi, if you want to hop in, if you would agree, or if you have any, more specific recommendations for how to handle that scenario.
No, yeah, I agree. I think just the more information, the better. Obviously, if you don't have, every piece of information, but, it's better to have something documented that you could go back and pull up and, have that record of. So yeah, definitely agree. Just documenting as much as you have.
Okay, thanks. Next question. What crystal report is pulled up when you click on the PHI history button?
Yeah, Chelsea, so I can take this one. So the crystal report, it typically is there by default, but if it isn't for your practice, the name is just PHI Log History. So it's typically found under that All Encounters for Current Patient folder under crystal reports. So like I said, that's typically there by default, but if for some reason that you don't have it, available, that's something that you could, go to NextGen support and ask that they add that report for you.
Great, thanks, Lexi. Next question here for Holland. Hi, great presentation as usual. You keep mentioning state laws may be more strict. Do you know where we would find our specific state information?
Yes, absolutely. That is a great question. Each state will have revised codes or statutes. I know personally for this webinar, we just went ahead and threw a good Google search in there to find those laws, but it might be a little tedious, but we do recommend reading through, coming through, and finding those more specific state laws that are going to apply to you and your practice.
Okay, thanks. Next question. Where is the HIPAA disclosure information housed?
Yeah, Chelsea, I can take this one as well. So I'm assuming you mean the actual, like the HIPAA form that the patient fills out. So typically that is done, on a paper form. Usually if you do have any kinds of, check-in like Phreesia or, a kiosk, something like that, you might do it electronically, or even with the pre-check functionality with Portal. It might be electronic, but so basically that documentation is usually, if it's not brought into the system automatically by again a kiosk or something like that, the paper version is found under the categories tab, usually of the patient history toolbar, and then the actual form to fill out kind of what a summary of what's on that, so practices or your staff can reference, is found typically in the patient information bar. There's usually a HIPAA link, so you can see kind of that information.
So while that was super thorough, Lexi, and thank you, they actually clarified their question. They were interested in knowing where the template for communication can be found in NextGen.
The template for so. Okay, again, hopefully I'm understanding and don't go this another way again. So I'm assuming if you mean to document like a communication with a patient, so and maybe it's involving a disclosure. So my recommendation would be to use like the telephone call template that can be used to document, if that's the template that you're using, or even the more updated communication component. That can definitely be used to document any information or communications with the patient. That's kind of why they went away from telephone to naming it communication component. And then even within that template, there are links to like HIPAA, for example, to see that template, or the PHI, you can link that to the PHI log. So hopefully that's what you were asking.
Okay, sorry, another clarification. You had a slide with the template names HIPAA disclosure information.
Okay, I'm gonna have to go back and check on that one and see.
Okay, I'll let you check on that one.
Oh, that one. Okay, I did.
Did you get it?
I did. I pulled it up.
Okay.
So that's the pop-up that I'm referencing. So it's not truly a template. It's just a pop-up that you would access from the top of your patient information bar. Typically, there's usually a HIPAA link there.
Okay, if you have questions, Heather, feel free to, you see both Lexi's and Helen's information up on the screen. Feel free to email them directly or give them a call if you still have questions on it. Okay, what is the best reporting to use in NextGen to monitor practice PHI logs for timely access? To clarify, practice-wide, not practice-specific. Want me to read that one again?
I don't know if we lost Holland. Okay. So yeah, as far as for timely access, so I'm just trying to think off the top of my head if there's really any built-in. There's not an built-in I'm aware of, but I do know you might be able to create a custom EHR report that would potentially be able to pull from that log. So I'm not positive offhand if there is one that's available out of the box. So that would probably be something you could go into that EHR report writer and pull in the fields. If you're familiar with pulling them in, to make a custom report, you probably have to pull in those fields to be able to track that access.
Great, thanks, Lexi. Next question. Do sensitive encounters get sent out via NextGen Share?
I want to jump in. I'm going to say I don't believe they do, Lexi, if you want to clarify that one.
So no, as long as you have your NextGen Share, there are some settings. I just want to point out specific with NextGen Share, so you would set that up in your NextGen Rosetta service, but that can specify whether to exclude things like sensitive encounters. So that would just be something to look into if that's something your practice is interested in using, but typically that's enabled, and then you are correct, that's part of the purpose, is it wouldn't automatically be sent out for things like referrals through NextGen Share.
But probably good to double check their practices settings, right?
Yes, definitely.
Absolutely.
Okay, next question. Looks like we're getting down towards the end here. Is there a way to view current HIPAA authorizations without having to create an encounter? When you click on the HIPAA button on the toolbar, it's blank unless it's a new encounter.
So you should be able to still view the information regardless, because it's not linked to a specific encounter, it's just from the patient information bar. I was able to just test it real quick to see it's not going to allow you to make any updates, is maybe what you're referencing, without that encounter. but you still should be able to see the information. So, you know, if there's a specific use case where you're not seeing that, potentially we could take a look. But typically it is, you're correct, it's usually viewed and managed, you know, during an unlocked encounter. So either it's an encounter for, you know, that particular visit that maybe disclosure is happening, or, you know, if it's just an encounter for communication, so you have an encounter open, things like that.
Great, thank you, Lexi. And it looks like this may be our last question. When updating patient email address in Practice Portal, does it link to update in the patient demographics? If the answer is no, I don't understand the rest of that. Let me reread that again, I'm sorry. When updating patient email addresses in Practice Portal, does it link to update in patient demographics? Helen, do you want to take that one?
Yep, I'll jump in. So, you know, updating that email information in Practice Portal regarding that PxP, it will not link. So you will have to go into, you know, the EHR or PM and update that demographic information with that new email address. Yep.
Okay, well, that's all the questions. Somebody chimed in to say thank you. That's a very good and informative meeting. So thanks so much for that. Holland and Lexi worked really hard on this one and they did a great job, and we hope that you were able to get something out of it. If you have any follow-up questions, again, you see Lexi's and Holland's information up on the screen. You can always feel free to reach out to them directly. Otherwise, you can reply back to the email that I'll be sending in a few days here with a link to the recording and slides. Basically, any way you can get a hold of us, we're happy to help. That's what we're here for, so don't hesitate to reach out to us. And thanks for joining us today.
Thank you, everyone.
Thanks, everyone.